Hi guys, good afternoon. How are you guys doing today? Happy Monday. We have our lovely Dr. Porter here today with us. We're going to be asking her some questions, you guys. So if you have any questions or any doubts, you can just put them in the chat. Remember, you guys, we're located in Miami, Florida. The location we're currently in right now is in Doral, and this is where you can find Dr. Porter, okay? So let's get started with our questions. What's your favorite cosmetic procedure to perform and why?
I really like tummy tucks, just because the lipo, yes, you can remove fat, but you can do that with diet and exercise. The tummy tuck really gets rid of stubborn, it's extra skin, and it makes a big change for people.
Great. What are the most common misconceptions patients have about post-op care?
That there is none. People think that you're gonna come in and leave, you do, you go home that day, but that you're gonna get results like that. But there's a lot of swelling and just a lot of work that has to go into it. The surgery is most of the work where your body takes time to heal.
Of course. How do you decide whether a patient needs liposuction alone versus a tummy tuck?
Just based on the amount of skin. Sometimes you can tell with your belly button. If it kind of has like the sad looking belly button, then you technically have extra skin. You can use a tummy tuck. If you have diastasis, so if you lay down and tuck your chin to your chest and you see like a ridge coming out from your chest to your pubic area, then that means that you need your muscles brought together. And then if you have stuff hanging over your underwear or pants, then you definitely need a tummy tuck.
So because of how would you say when someone is telling you, well, I really want to get the mini tummy tuck, but they have lots of excess skin?
Yeah, there's no such thing.
Yeah, right.
So unfortunately, not a miracle worker, but for mini tummy tuck, it's very few people that are actually candidates. A lot of times people who have had tummy tucks in the past, but if you have any of that sad belly button looking, then you need the full tummy tuck. Or if you need the muscles brought together, you can't really do that with the mini tummy tuck either.
Great, okay. So, what are the red flags for a patient with diabetes who wants to undergo surgery, and what can they do to prepare for surgery?
It just has to be controlled. The A1C has to be less than 7 to have good care. Obviously, your primary care doctor or your endocrinologist. So just to minimize postoperative complications.
Okay. Great. Can fat from previous liposuction be used for a future BBL?
No.
How come?
There's no good way of storing it, and then risk of infection and stuff like that. So yeah.
So yeah, very important, you guys. If you're getting a lipo but you would like to, get some volume to your BBL, you better take advantage of the fact that you're getting that fat at the moment, right?
Mm-hmm.
At the very moment. Okay. What role does muscle repair play in achieving a flat abdomen after a tummy tuck?
So again, if you're laying down and you tuck your chin to your chest and you see like a ridge, or if you stand in the mirror and suck in and you're flat, then that means you have diastasis. So if you just get lipo and you're relaxed, you're not sucking in, you're still gonna have that roundness until you suck in. But if you get the muscles repaired, then that helps tighten the muscles so that you're flatter.
Mm-hmm.
Without having to suck in.
Okay, great. Can a tummy tuck fix stretch marks?
Some of them, but it depends on where the stretch marks are. It has to be included in the skin that we're removing. So if you have them up here more, or you don't have as much skin, then some of the stretch marks will stay behind.
Oh, okay. So for someone that, let's say, has lots of excess skin, right? You could try to push down as much as possible to try to... Yeah, you guys, you see? Dr. Porter here. I'm telling you guys, come book with her. So, what factors determine whether you use saline or silicone implants?
It's patient preference. Most people use silicone. It just looks more natural. It has more of the natural teardrop. Once it settles, everything looks crazy at first. But the saline tends to have more of a fuller like upper pole look, and it's not as soft as natural.
To the touch.
Yeah.
Okay, so for a patient, for example, that doesn't really know which one to choose, you would recommend them the silicone?
Yeah, that's what most people prefer.
Yeah, of course, okay. So, wait, I'm sorry. What's the best option for patients who want a very subtle breast augmentation?
Who subtle?
Mm-hmm.
I put my implants below the muscle unless there's like extenuating circumstances. So, or just trusting me on the size of the implant, versus your body. Like for a very small person or a very like narrow person, 300 is going to be huge on them versus somebody like me who's taller, not super tiny. Then you're like a 300 would, it would give me volume, but it's not going to have the same effect that it would on them.
Of course. So let's say for somebody that is on the slimmer side but they want really big breasts, would you say that the skin elasticity matters a lot, right?
Yeah.
Matters a lot.
The skin, and then like the actual like width of your chest, because you can put in a huge implant, but then you're at higher risk for complications down the road, and you have like it hangs off the side of the chest, because the bigger you go with the implant, the wider it gets. Not so much, it doesn't project more so much, it just gets wider.
Oh wow, I didn't even know that. Oh wow. How do you determine if a patient needs a fleur-de-lis tummy tuck versus a traditional one?
So for patients, massive weight loss patients, who have like lots of extra skin, so pulling in for the regular tummy tuck, it's an incision down here. A fleur-de-lis is like a zipper almost, up from the pubic area to the sternum. So again, you have a very large scar. So there are some people who definitely need it. Some people are kind of borderline. You can always be more conservative if the patient is not willing to commit to that scar and say, okay, within reason, we could just try the tummy tuck and you can always come back later. But that's patient preference up to them.
Of course. Is a breast lift recommended after significant weight loss?
It depends on what the patient wants.
Of course, so for example, for someone that maybe they had a little bit of fuller breasts, and now since they've lost lots of weight, would you say that, let's say they feel a little insecure about their breasts, would you say that a breast lift would be like the perfect choice for them?
Depends on the patient's breast. If it's a lot of extra skin and like depending on the position of the nipple and stuff, then yeah, you definitely need a lift. But if you want like the upper pole fullness, then you need an implant.
Of course. How can you maintain your breast lift results? How can you maintain them,
So for the first 6 months, wearing just like a compressive, like supportive bra, no underwire. But honestly, gravity is always gonna win. So when we're doing a breast lift, you're rearranging where the nipple sits and removing excess skin. But yes, you may need a little bit of a reduction too, depending, because if you have a lot of breast tissue, then the weight can pull it down. So it all depends on your skin, just meeting with your surgeon beforehand.
Of course. Okay. Can a breast reduction also improve back pain and posture?
Yeah, they do. If your breasts are significantly big enough, have lots of volume, breast tissue. Yes.
Okay. How do you determine how much tissue to remove during a breast reduction?
So that depends on the size that we're working with. A lot of people, I've had women with like breasts down to here say, I just want them lifted. That's not possible, because they would be out to here if they were lifted, and then they would fall right back down. So you have to remove some of the breast tissue, but just talking, with the patient beforehand, if you have very large, pendulous, dense breasts, some of it has to, if you want them lifted, they also need to get reduced.
Of course, of course. What's the best way to create a balanced figure during a mommy makeover?
Well, everybody has their own anatomy. Everybody comes in different shapes and sizes. So, you know, some people are gonna have tinier waists to bigger hip ratios. Whatever you looked like when you were a teenager, you know, if you were in shape then, or some people have like more of like a slender build, other people are curvier. So we just try to work with the build that you have.
Of course, of course. Can a mommy makeover address C-section scars?
Yeah, usually the abdominoplasty scar removes that. Now you are getting a bigger scar with that C-section scar, but a lot of people are happy because like the shelf is not there anymore.
Oh, nice, nice. How do you handle asymmetry during a breast reduction?
So we do markings beforehand, measurements, but everybody has to remember that your breasts are sisters and they are not twins. So they're never ever going to be 100% perfectly symmetric.
How do you handle cases where patients want a second round of BBL?
As long as you, some patients come back and you can't tell that they had lipo done, and other people it's maybe we need to look at your arms or your thighs to get a little bit of extra fat. But as long as, you know, we have a discussion before about realistic expectation about the amount of fat that can be grafted and stuff and what your goals are. Everybody's different. Everybody wants different things.
Of course. How do you determine how much skin to remove without over tightening when you're doing a tummy tuck?
So we sit them up, like it's called tummy tuck position, but you flex them, and then as long as you know it can reach, there should be like a little bit of tension when we're closing, but not so much that we're nervous that it's going to be open the next day.
Of course, of course.
It's a fine balance.
So for somebody that got a breast augmentation done somewhere else and they come to you and they would like for you to correct the double bubble saying, you know, how do you correct double bubble deformity after a breast augmentation?
You have to recreate the IMF, so everybody's a little bit different. So you know, we would have to talk about that like on a case-by-case basis.
Of course. So, how do you prioritize which procedures to perform during a mommy makeover, as in what order?
So I always do the breast first. They take a little bit longer. It just takes a little bit more intricate detail. So I like to do that first, get them over with, and then the tummy tuck, it's pretty standard for everyone. So.
Okay. Can you perform a breast lift without moving the nipple?
No, because the lift by nature is fixing where the nipple is sitting.
Of course, of course. What techniques do you use to maintain upper pull fullness during a breast lift?
Maintaining. So I usually do superior pedicles, which keeps your upper breast tissue. Does that mean that you're going to have upper pull fullness necessarily? No. So if you look at how your breasts are right now, if you haven't had anything done, the shape of them and stuff, so they will be a little bit perkier. I mean, at first they'll be perky and stuff, but then after, you know, a year or so, they'll be a similar shape to how they are now, but the nipple will sit higher. Some people are lucky they have better skin, but yeah, if you really with the upper pull fullness, you need an implant.
Of course. How do you manage patients with underlying health conditions who want surgery? Like, do they need extra testing and stuff like that?
Yeah, so it just depends what it is. A lot of times it's not really an issue. Some patients, you know, the risk isn't worth the surgery. Other people just need to see if they see a specialist or something. Again, this is totally elective surgery. Nobody needs this. I mean, obviously it can boost your confidence and stuff like that, but my number one priority is always safety. So.
And that's why Dr. Porter is so amazing, because she's gonna deliver results and make sure you're safe, you guys. So come book with her. We're located in Miami, Florida. Our location is here in Doral, where you can find our lovely Dr. Porter. Okay? So, the next question is, how do you manage patient expectations when it comes to results?
I'm very realistic. So if you show me a picture that, let's say that you're taller with you don't really have your waist is similar size to your hips, and you want a BBL that is super curvy, very narrow waist, big butt, that's most likely never going to be you. So I like to set those expectations. Everything is within reason, and I'll tell you if we could achieve that potentially or not.
So for somebody that has gone somewhere else and they come to you and they're like, Dr. Porter, my breasts are sitting way too high up, how do you handle cases where the implants sit too high?
So you have to give yourself time, because at first they will ride high. That's just naturally. If they haven't settled, then potentially could be contracted. So yeah, again, case by case basis, but you may need the capsule removed, and there's different grades of contracture and stuff. Again, case by case basis.
Of course. What's the smallest size a patient can go down to after a breast reduction?
So I never promise people cup sizes or specific sizes, because it's very hard to achieve that. But again, it depends on your goals, what within reason we can keep or get rid of. People who come with, again, these very pendulous, large, fibrous breasts, you're gonna have to say goodbye to a lot of that tissue, but you're never gonna be super, super tiny. Definitely way smaller than you were, but it also depends on the width of your chest and stuff too.
It all depends on the specific person.
Yeah.
What are the main difference in recovery between a breast lift and a breast reduction?
There's really no difference. Usually same incisions.
No, it's okay, doctor, no worries.
Yeah, usually same incisions. Yeah.
So nothing really changes, and there's nothing different that they should do, nothing. Okay. Can a breast reduction also improve the shape and position of the breast?
Yeah. So your nipples are going to be back where they once were, or whatever
Amazing.
Looks correct for you. It's definitely going to help improve the shape and stuff, but again, gravity always wins, so eventually there will be some sagging again.
Of course. Is it true that I can get my chin lipo with local anesthesia with Dr. Porter, or is it better to add it to another procedure?
It depends if you want other things done. If your chin just really bothers you, then yeah, you could do it locally. Then you don't need general anesthesia. You can just go home, right after, without being all drowsy and stuff.
So, for can implants be placed through the armpit?
Some people do them that way. I do not. I always use this incision. It's safer.
Yeah.
It gives you the best exposure to really see what's going on. Make sure that there's nothing that's potentially oozing still or whatever. Yeah.
Great, amazing. So I have a question here that says, how do you determine how much tissue to remove while keeping a natural look?
For breast?
Yeah, for breast reduction or breast lift.
So again, if you're not getting an implant, everything's gonna look natural. Especially with time. At first it'll be more boxy and stuff, but after a few months it settles. It's gonna look very natural. How much tissue to remove? It depends on kind of the weight of the tissue, how your skin is. If you have very thin skin with stretch marks, then you need to remove a lot of the tissue, because it's not gonna hold that breast tissue very well.
Of course. So last question, and if you guys have any questions, any doubts, you guys can put them in the chat. Leave your information right here in my left bottom corner, or in her left bottom corner. You're gonna see this blue folder right here where you can put your phone number, your name, and your email, whatever's the best way to get in contact with you guys. That way we can get in contact with you, okay? So also remember, we do offer free virtual consultations and free in-person consultations, you guys. So can a mommy makeover address areas like the flanks? Let's say for example, let's say I'm experiencing a lot of excess skin on my flanks. Does it get to the flanks?
So if you have extra fat, usually the tummy tucks do liposuction there. If you have extra skin, that's where you need that kind of like fleur de lis, or the big tummy. Sometimes we again can see if we can get away with just a regular tummy tuck, and it all depends how aggressive you want to be. So
of course. Well, thank you so much, Dr. Porter. Thank you so much for being here today and answering our questions. Thank you guys for joining the live today. No, thank you so much. And stay tuned, because we're gonna be coming back with lots of exciting information. And don't wait any longer to get your chin lipo, girl, guy, everyone that's listening to me. You don't have to suffer in silence. Right now, for $1,500 with local anesthesia, you can get your chin lipo with Dr. Porter, you guys, okay? So thank you so much for joining the live today. Have an amazing day, and we'll see you back very soon. Bye.